Coming to you live from PRS View Studios, this is your Plastic Surgery Minute.
Good morning, Dr. Sheila. It's a real pleasure to meet you. You're one of my social media article heroes.
Likewise.
Really enjoyed your article in October, PRS. Can you tell me what is the most important message about your article to the public?
Yeah, thanks. It's great to meet you as well. I think the great message for the public is really reiterating the do your homework message in terms of always trying to find a board-certified qualified professional to perform your plastic surgical procedure. And knowing that as plastic surgeons, we are now adhering to a very strict code of ethical conduct when it comes to social media, which really isn't that much of a change from the past. We've always had a very strict code of conduct that ASPS members, board-certified plastic surgeons, have chosen to adhere to. And if patients are seeing really outrageous content online, chances are this is not one of our members and probably not someone that they should be seeking out for their treatment.
And this is in particular in relation to Snapchat.
Snapchat in particular. Snapchat really was born as a social media channel that was designed to really promote and encourage racier content. The fact that it disappears in 24 hours and as a mechanism for teenagers to send inappropriate pictures to one another.
Sure.
And so we do feel that in the plastic surgery realm, because it's a uniquely visual medium, it does seem to have encouraged a particularly outrageous variety of content. And so we were just really trying to get ahead of the curve and help people understand that we in plastic surgery, organized plastic surgery, are aware of these issues, and we do want to conduct ourselves with a degree of decorum and respect for the physician-patient relationship.
Fantastic. And can I just ask you, what type of content do you feel crosses that line in terms of the decorum and respect for that physician-patient relationship?
Certainly, that's a great question. I think when it comes to content online and social media, in many ways the edgier the better in terms of virality.
Sure.
This does tend to encourage some gray areas, and we're all for free speech and the sharing of exciting content that's going to be engaging and entertaining. We do feel that when you're dealing with the physician-patient relationship, specifically whether it's in the operating room or even in a consultation, that's a relationship that really should be respected with some degree of decorum. And so I do think, for instance, during a surgery, when a patient is visible under general anesthesia, if you take time away from the operation to sing or dance or manipulate body parts in a disrespectful way, that really does seem to cross the line in our opinion.
And it trivializes plastic surgery.
Absolutely.
Are you worried about the demographic for those more visual media, that it's a much younger audience than perhaps some of the other social media channels?
Well, tastes change, and I think what was really outrageous 1 or 2 generations ago is considered normal in terms of decorum these day and age. And so we certainly don't want to portray ourselves as being stodgy or stuck in the past. We understand that millennials and the next generation, with their engagement in social media, it tends to encourage a more engaging, dynamic, unfiltered access. I think there's a hunger amongst the public for unfiltered access to what happens in the operating room. Where we really do feel like it crosses the line is when that encourages the surgeon to do things that are actually above and beyond what they would normally do in the operating room.
Sure.
Singing and dancing, juggling body parts, really inappropriate behavior, disrespectful to the patient, as you said.
Sure. So we have an educational role, but we shouldn't market ourselves using these media.
Absolutely. As you beautifully pointed out in your hashtag plastic surgery article and your work online, patients want educational rather than promotional material.
Yeah.
And that's something that as organized plastic surgeons, board-certified plastic surgeons, I think we can hold ourselves to that higher standard.
Fantastic. We're looking forward to your talks this afternoon. Thank you very much.
Wonderful. Thank you. Great meeting you.